welcome to Hey Nurse, and in today's video we are going over cranial nerves. So get your pen, get your paper, get active, and let's do it. So I have my son here. He's going to be my patient for this assessment. I highly encourage you to utilize family members, doll, if you got to draw a picture, or even yourself. Do whatever you have to do to practice skills. The more you do it, the more you're actually going to retain the information and get away from memorization to actual understanding and application. Alright, so going over cranial nerve 1, olfactory. Push in one side of your nose so that you can't breathe through it. You holding it? Okay, tell me what you smell. Alright.
Cinnamon.
Alright, other side?
Cinnamon, yeah.
And that is correct. Ta-da! From Trader Joe's, baby. Okay, so with that nerve, we are testing to see if he is able to smell, basically, right? Okay, so a big deal there. We want to make sure that he is able to smell bilaterally, so on both sides of the nose. So again, that's why I had him to occlude one side, inhale, occlude the other side, and then be able to tell me what he smells. So there, he was good. All right, moving on to number 2. So this one is going to be our vision. Okay, it's very important that we separate the visual aspect of the cranial nerves from the eye movement aspect. So cranial nerve 2 is the optic nerve, and again, it's responsible for vision. So in order to test visual acuity, which is associated with the cranial nerve 2 optic nerve, we want to use the Snellen chart, which would be this. Ta-da! Okay, so remember, we have the patient stand 20 feet back. They read the line that they can read, and then we determine, you know, all of that, the numbers. So that's another video in terms of the Snellen chart, but the biggest deal is I wanted to give you a visualization of what the chart was. The second test that we can do is confrontation. Let me demonstrate. So I have 2 index cards right here. Supposed to use like an opaque card or something like that, but this is going to be opaque enough. So you take this card, okay, face me. So put it over your right eye. Flip it this way. Okay, and I'm going to put it over my left eye. So it's matching on the same side, but it's opposite because we're facing each other. Hopefully that makes sense. But nonetheless, all right, continue to look at me, okay? And I want you to say now every time you see my fingers coming, okay?
Now.
Not yet. Here we go.
Now. Now. Now.
Good. All right. Other side.
Now.
Wait. Look at me.
Now. Now. Now.
Okay. So what I want to demonstrate with this test, right, is that as my fingers are coming in from the side, remember we're looking at or testing the peripheral aspect of it, right? So can he see the side? That's why I told him to look at me, right? In his central visual field, right? But this is testing the peripheral. This is why when we're facing each other and saying now when we see it, when I see it, the client should also see it at the same time. So that is why when he said now, I should have also been seeing it and able to confirm, you know, did we see it coming in at the same time? If I'm able to see it and the client is not saying now, that's a problem. They may have a peripheral vision field loss. Now I'm moving on to cranial nerves 3, 4, and 6. Oculomotor, Trochlear, and Abducens. Okay? So these are going to be responsible for eye movement. So there are 2 tests that can be done for this. We're going to do the cardinal fields of gaze and then the peripheral. I'm going to ask you to follow this only with your eyes, okay?
Okay.
I
already knew it was coming, so I guessed it.
Yeah. All right. So, though, as you saw, you know, we are testing eye movement, right? Again, optic nerve 2, that's vision. 3, 4, and 6 is eye movement, and pupillary response, which is still eye movement, right? So we did the cardinal, fields of gaze, and peripheral. So peripheral stands for pupils are equal, round, reactive to light, and accommodation. So we're supposed to be looking at his pupils. This pupil size should match this size pupil size. Okay, so we have a pen light here, right? It has 2 through 9 millimeters. One is able to compare this to the client's pupils, and it should be the same on both sides. Whenever you go to measure your client's eyes, if it is 4 on this side, then it needs to be 4 on the other side. If one is dilated while the other is constricted, then that may be a sign of something's going on. It could be increased intracranial pressure or something is happening. The acronym was pupils are equal, so that's in size, round as in shape, reactive to light. When I shine a light, do they react, right? Reactive to light, they should constrict whenever I shine a light, right? And then accommodation. So in terms of accommodation, we take our pen light from a far distance, look straight ahead. Keep your eyes on the pen light. All right? And this is what should be happening whenever you do it. If you notice, his eyes, we'll do it again. This one. They converged, as in kind of crossed, right, or came to the middle, right? And then if looking in at his pupils, they constricted, okay? So they got smaller. That is accommodation. So next up is 5, all right? We skip 5 because 3, 4, and 6 go together. 5 is trigeminal, all right? So that one has a motor and sensory component. So for the motor component, we are going to palpate the temporal area and down here for the jaw area. Then we're going to ask that client to clench your jaw. And right now I'm pushing to see if I'm able to open his jaw, right? Because this is involving the muscles of mastication or being able to chew, right? So clenching the jaw, I'm not able to open his mouth. The sensory component of it, I am going to take a cotton ball and close your eyes. Tell me every time you feel me touch, okay?
1, 2, 3.
All right, so we touched in 3 different areas. He just decided to say 1, 2, 3, but that works. And so he was able to sense, feeling, touch, right? So again, when we say sensory, that means feeling, right? In terms of motor is movement. All right, so good. We got trigeminal down. On to skipping 6 because we already talked about that. On to 7. And for some reason, people always confuse 5 and 7. So make a clear distinction. 7 is going to be facial. So with facial, my little face. All right, with facial, this is gonna innervate facial movement, right? So can I get you to smile? Puff out your cheeks. All right, I'm gonna try and push. All right, and air should come out both sides, right? Can you frown? I know frowning is kind of confused, like, I don't really know how to frown. Anyway, I'm sure we do it unconsciously sometimes, but whatever. Raise your eyebrows. Good. All right, so all of those things are intact, right? Okay. Oh. You came back with it, right? And then the other component of facial is taste. So maybe I can have a taste. No, he's not gonna really have it. So anyway, we have this cinnamon. Maybe if the client is able to taste something, right? Moving on to cranial nerve 8. This is a vestibulocochlear or acoustic. All right, and acoustic as in like the hearing and the ability to hear. It's also responsible for equilibrium. So in terms of hearing, we're gonna do the whisper test. So I will have him stand up here, cover an ear. I'm going to stand behind him and I'm going to whisper something to you and I need you to repeat what you hear. B95.
B95.
Other side.
J21.
There you go. All right, so he successfully passed the whisper test. All right, moving on to 9 and 10, who are also a unit. They together forever, ever, forever, ever. So 9 is going to be glossopharyngeal, and then 10 is going to be vagus. Them together, we are going to assess the gag reflex. First, we're going to have the client say, ah, ah, good. Good. So that little thing hanging in the middle. That is the uvula.
What if somebody, what if like a dentist reach back there and pluck it?
The dentist is not reaching back there to pluck it. That is the uvula, all right? This is assessed to see, is it midline? So when the person says ah, it should rise and then be in the midline, okay? Shouldn't be deviating to the right or to the left. Also, we're going to assess the gag reflex. The thing about it, you're supposed to use a tongue blade. I don't have that, so I'm just using a straw. That kind of thing. Okay, number 11 is spinal accessory nerve, all right? Move your cheek towards my hand. Push, 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 push. Okay, other side, push, 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 push. Push with your head only, not with your body, with your head only. No, like with your face only. Turn it.
Oh, like this?
Yep. Push, 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 push. Raise your shoulders. All right, right now he's trying to raise it against resistance because I am holding them. I'm not pushing down, but I'm just holding them in place. So push again or try and raise them up. There we go.
Y'all hurt my shoulders too.
Yeah. And the last one is going to be hypoglossal. So another common thing is that people want to put 12 with 9 and 10. No, okay? It's not the side chick. It's not the mistress, okay? It's just his own little person on a single island, okay? Hypoglossal. Kobe, I'm going to get you. Can you stick your tongue out for me? Move it to the right. Move it to the left. There you go. Now, can I get you to say light, tight, dynamite?
Light, tight, dynamite.
Light, tight, dynamite. Light, tight, dynamite.
Light, tight, dynamite. Light, tight, dynamite. Light, tight, dynamite.
Alright, that is a wrap to these cranial nerves. Hopefully you're able to run through it. I wish you well on your checkoff. I will have another video talking about maybe some abnormalities that may come with these cranial nerves, working through like some practice questions and critical thinking in terms of the cranial nerves. So I will catch you in the next video. Hope you enjoyed this video. Until next time, bye y'all.